Joining us this morning, our friends from Titusville Area Hospital, and Holli Wolfe makes her triumphant return to the studio. Hi, Holli. How are you?
I'm great, Luke. How are you?
Good to see you this morning.
It is great to see you.
I love these segments. You introduce us to great new people all the time. Who'd you bring in this morning?
I brought in Dr. Lisa Rubin. She is our new gynecologist at the hospital. She is
Good morning.
board certified in gynecology. We are so excited to have her. A lot of females prefer to have a female gynecologist.
Even I do.
Yeah, I'm sure you do. So it's great to have her here. She started a few weeks ago. She's already starting to see patients in our clinic at the hospital, and we're extremely happy to have her on board.
Well, it's welcome. Yeah. Dr. Rubin, good morning. Good to see you.
Good morning.
Welcome.
Thank you.
Tell us a little bit about yourself.
I am a gynecologist. I've been in practice for 31 years. I did my medical school training at GW in DC, and then I moved to Baltimore with my husband, who's the orthopedic surgeon here, and did my residency in Baltimore, Maryland. And then after that, I went out into private practice, and I was in a practice there for, as I said, about 30 years. I did practice both obstetrics and gynecology when I first went out into practice. But then after having 3 children, it just, and I was a solo practitioner, it was a little bit much. So I gave up the OB and have been doing gynecology since then.
I know one of your kids, and he'd be a handful to begin with, I'm sure.
Yes.
No, I'm just joking. So did you always know this was the direction you wanted to go? Or what point in life did you say, boy, this is I think, something I want to do?
Well, actually, I wanted to be a doctor since I can remember. I don't have any memory of not ever wanting to be a doctor. My grandfather was a doctor, and I used to hang out at his office and make rounds with him, as a child. So I always knew that, and that was pretty direct route for me. Once I graduated college in 3 years so that I could work a year before I went to medical school, and I worked at a psychiatric hospital with teenagers who were suicidal. And I actually thought I wanted to go into either adolescent medicine or psychiatry, but once I was doing my rotations in medical school, I realized I wanted something surgical. I wanted something that was a little more fast-paced. And OBGYN gave me a little bit of all of that. I was able to deliver babies, which is very fast-paced, and then there's the surgery, and yet I still have continuity.
And a lot of screaming, too.
No. There doesn't have to be a lot of
Where
screaming.
I was, there
Doesn't have to be a lot of screaming. No, and I was able to sort of combine all of that. I love the continuity of care, of seeing the patients year in and year out, where a lot of surgical specialties don't do that. And back in Baltimore, I was seeing patients who I had delivered. Mothers brought their daughters brought their mothers.
Wow.
I had, whole families from grandmothers down to daughters. So I was able to do that primary care thing. I also, really like seeing teenagers, which a lot of doctors maybe don't feel that way. But, and so, you do see a lot of teenage girls who are wanting birth control or just becoming sexually active or just, starting out having issues, other female issues. So,
and a lot of times what they'd be uncomfortable probably talking to parents or mom about that, right? So this would be the first introduction to somebody they could talk to.
Absolutely. And so, it allows me to see, all age groups, but really also be able to see those teenagers and, to be able to follow them through, which is really nice.
And I don't know, Holli, if you want to get into this like right now, the specifics of it, but what age should somebody be making that first appointment?
Usually, I would say that if they're not having any problems or they're not interested in birth control or they're not sexually active, about 18. But if the daughter looks like she's going to be sexually active, you want to get her in before that time. So, that's sort of the gauge. Or certainly after they've started their periods, if they're starting to have problems, then they could come as well.
Yeah, so that would be fairly early on then.
Yeah, I mean, I don't usually see too many girls below the age of 14. So I would say that 14 is about the age where we start to see some of the girls.
Painful periods starting out, things like that is something
or
that's
irregular, or heavy, or yeah, absolutely.
Because that could lead to, or there could be an underlying issue there. And
yeah, or they're missing school. And so we want to do something about it so they're not missing school.
Holli, this is another fantastic piece to the hospital, adding these services. Kind of talk about that conversation and bringing Dr. Rubin in.
Yeah, I mean, having her on board is fantastic. We have, we're really building up the RHC, and while gynecology is really considered primary care, we're trying to get a lot of specialty services in the hospital, so folks don't have to travel. We've had Dr. Frere at the hospital for a long time, but he is a male, so having the Dr. Rubin here as a female, that's what a lot of people do prefer. So they will no longer have to travel out of town for that service. So it's really been great. We've been waiting for her to come and anticipating her. So it's good to have her on board, and she comes with so much experience, which is always a wonderful thing.
Yeah, and I would imagine that's going to be very helpful. Again, coming in here, Dr. Rubin, and kind of walk us through the the age groups and maybe some of the things that people should be thinking of as they enter into the different stages of their life.
Sure. First we talked about the teenagers, and then certainly you have, the young women who basically either need birth control or well woman visits. They also can have problems with their periods or pain problems. So those would be all reasons to come. Certainly if they're wanting obstetrics, then we're not going to be able to provide that for them. And then once women have their children, their needs for birth control change. They also don't need to go to an obstetrician, and they want to go just to a gynecologist. And again, we handle all kinds of issues having to do with menstrual problems, pain, and then certainly as you get into your 40s, there's the whole needing to have yearly mammograms, which it's now Breast Cancer Awareness Month. So, and I start teaching the young women to do breast exams so that, as they get older, they know what their normal breast architecture feels like, so that when they're in the regular habit of doing it, so that if in fact something presents, they'll know that this is something that's different and to call the doctor. And then certainly as women start to get into that perimenopausal period and menopause, they need counseling and guidance through that. Their sexual lives may change, and they may need, some counseling and help through that. I'm a starting point for women who are also having urologic problems. I don't do the reconstructive surgeries anymore, mostly having to do with the whole mesh issue. So I do refer them to your gynecologist, but a lot of times they don't even know what the problem is, and we can start to figure that out to know what they need and whether it's medical treatment or surgical. So those are all issues, vaginal dryness for the older women, pain with intercourse. So those are all different services that are different issues that they might want to come to see a gynecologist for.
Now, with COVID, we know a lot of people have held off going to their doctors and making those appointments, but we're also talking about there could be some serious consequences by not going to your
Yes.
doctor and making those appointments. Can folks start making appointments with you now?
Absolutely.
Okay.
We're definitely seeing new patients. We're seeing new patients for just general yearlies, or if they have a problem, they don't need to wait to have a problem. If it's been a year since they've had a pap smear and they want to come in and start a relationship, establish a relationship, this is a good time to do it.
You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel and listening to it on the Allegheny News Talk Sports Network. Here with our friends from Titusville Area Hospital, and Dr. Rubin brought it up, Holly. October is Breast Cancer Awareness Month.
Yes, it is. We have 2 years ago we purchased the 3D mammography machine at the hospital, and it's state of the art and really the best means of having a mammogram out there. So we are happy to offer that at our hospital. Dr. Rubin mentioned, and when women are in their 40s, they should start having their annual mammogram. So we always like to remind people about that. And we also have the free mammogram program at the hospital through the foundation. Of course, you have to be uninsured or underinsured to qualify for the free mammogram, but since we started that in 2009, we've had over 370 people come through for free mammograms. So, we're really proud to offer that. And if anyone ever has any questions, they could call the foundation at 827-8717, and we're happy to walk them through that. A lot of physicians are aware of the program as well, so when they see patients in their office, they know that they need a mammogram because it's been a year, and they can help them through that as well and send the referral over, and then we'll complete the registration form for the free mammogram.
October's a busy month.
Yes.
Because it's also Physical Therapy Month.
It is. It's National Physical Therapy Month, and we have a great team of physical therapists at the hospital that see the inpatients, and then also on Central Avenue at our outpatient office. And we're always proud to recognize those folks and the great things that they do to help people, gain strength and mobility and get back to normal lives after an injury.
A couple of those people I'm not sure about. Dan Hasbrook's one.
They are
Kreiner.
all wonderful. They all
That's what I meant to
provide-
say. That's what I meant to say.
That's right. Yeah, yeah. And it's this week is pharmacy week, so we're happy to recognize all of our pharmacists as well. They're a huge part of our team at the hospital. They ensure that each patient has the right medication, and all of those types of things. Make sure there's no interactions with other medications they're taking. So we like to recognize them, and it's also Food Services Week for healthcare workers as well. So we have a lot going on,
Wow.
like you said, in October. So we like to recognize our departments, especially when it's during the national. I mean, we always like to recognize them, but when it's their special week, we like to do some extra things for them.
Penny. What is Penny?
Yeah, so Penny is the new Pennsylvania marketplace, and we have the navigator over at Meadville Medical Center. She previously would come over to Titusville Area Hospital on Wednesdays and help people enroll in that, but due to COVID, she's doing everything virtually. So she's not coming over to Titusville, but she can still help people enroll in the new system. You have to call for an appointment. The number is 333-1758, but Lisa Cox does a fantastic job in explaining the different options and really looking at maybe what kind of medications they take, or if they see specialists or things like that, to determine to give them the information for them to determine what would be the best route for them for their insurance.
And again, there's the phone number 814-333-1756, but can they also call Titusville Area Hospital and if they need more information, or
Yes.
they need to
Yep.
learn more? Okay.
Yep, they can definitely call the hospital at 827-1858, and we're happy to connect them with Lisa.
Okay. And for Dr. Rubin, what's the best approach there? Calling to schedule an appointment?
Yes.
Then we'll ask Dr. Rubin here. And again, with the youth, Dr. Rubin, pediatrician, PCP, can they also make those recommendations that they should contact you or schedule appointments with you?
Yes, absolutely.
Okay. And practice is open and running?
Practice is open and running.
Yeah.
I will also say that for older women as well, I do have an interest in osteoporosis, so I do try to make sure that all of my patients who need it get bone densities, and that's another interest as well.
Okay. And again, we're talking pretty much all ages here.
Yes.
So, and it sounds like with your background that there's some excitement to meet not just the individuals but the families and get to know folks here.
Absolutely. And I like to be able to make sure that all of their questions are answered, that they feel that they have the time they need to ask me questions. And yes, I do. I really do like to get to know my patients. That's the fun of it.
What do you get to do to relax?
I read. I like to hike. I like to sit by the beach. And I also have just started painting since COVID started. So,
wow.
Very nice.
So that's it.
Excellent. Well, that's good. Holli, hospital, again, busy place. What's going on behind the scenes?
Well, hopefully next month I will be able to tell you that we are finishing the ER project, which has been the topic for so long.
Have you brought that up before?
Yeah, maybe.
Okay.
Maybe once or twice.
It looks beautiful,
I can't
though.
remember. Yeah, I mean, it just looks amazing, and I can't wait to be able to share. We're working on like a virtual tour that people can take, because we wanted to do, of course, the open house, but we can't do that due to COVID. So we're working on getting a virtual tour put together that we can put on our website and share on our Facebook page, so people can see truly how amazing it looks. It just looks like a completely new area, which of course it is. We did a lot of renovations. We're in our last phase. We started the last phase yesterday. So in that phase has been the phase that we've been talking about, in which people need to enter through the front lobby entrance. That part deals with the overhang for where the ambulance bay is, and also getting rid of those steps that go down into the ER waiting room. So a ramp's going to be put in there. So the ER entrance is closed. So everyone has to come through the front lobby.
Excellent. Holli, good to see you. Dr.
Yes,
Rubin,
good to see you.
congratulations. Welcome, and
Thank you
best
very
of
much.
luck.